And welcome back, everyone. Former Vol and current Kansas City Chief Eric Berry is facing a new opponent. Doctors found a mass in his chest and fear it may be cancerous. Berry may have lymphoma, a blood cancer. He will undergo further testing in Atlanta. Joining us with more about lymphoma is Dr. Hanna, a medical oncologist and hematologist at UT Medical Center. Really appreciate you being with us today. Thanks for coming on. Let's begin. What is lymphoma?
Lymphoma is the malignant form for the lymph nodes. We all have lymph nodes everywhere, and the lymph nodes enlarge whenever you have infection or inflammation. But sometimes the lymph nodes can be involved by malignant tissue. They turn against us, and this malignant tissue can attack the entire body.
When we hear lymphoma, we often hear Hodgkin lymphoma and non-Hodgkin lymphoma. What's the difference between the two, and which one of those is more common?
The difference is in the appearance under the microscope, and the presentation and the spread. But eventually, both are treatable. Lymphoma is more common than Hodgkin's, but we have advanced in both, and both can be cured.
How do the symptoms present themselves? I know with Eric Berry, he complained of chest pain. But let's talk about the symptoms.
Well, the symptoms can be without any symptoms, and the patient will find a lymph node here that is enlarging. Or if the mass somewhere that's pressing on the surrounding tissue will cause pain. Or if in case of the lung, it can cause shortness of breath. So any of that will alert the doctors to do scans, and from the scan they found the masses. And then once you do that, then the next step would be to do a biopsy to determine the type, the grade of it, because all that will be needed to design your own treatment. You have to know how aggressive it is. It is low grade, it is high grade, and then after that you do scans to know the extent of it, the stage. Is it stage 1 or 2, 4, and based on all that. So
treatment will vary, obviously.
Exactly.
What are the different types of treatment, though?
Well, the main treatment is chemotherapy, but radiation is used, and that's why you have to. And you can sometimes use the combination, or sometimes you use monoclonal antibodies, which is like smart antibodies that seek the malignant cells, and sometimes you can use them in combination. So you have to know what type of cells you have, and what's the characteristic of the cells you have, and whether the cells have certain markers that you can use to design your treatment.
Wow.
And then once you have all the information, you compute all that to make a decision on what's the treatment plan. And sometimes we give treatments, and then once we finish the treatment, we give radiation to the areas where the cancer was, where the malignancy was, to try to eradicate it from there. I think the aim is to hopefully cure it.
Sure. We're almost out of time, but real quickly, Eric Berry seemed to be in very good health. Risk factors, are there risk factors for this?
Well, viral illnesses before this can predispose patients to develop it. Radiation, exposure to chemicals, or sometimes it happens for no good reason. And that's one of those.
Yeah.
And so our prayers for him. We're all emotionally involved with that.
Certainly, we're keeping him in our thoughts and our prayers, and he refers to it as a different type of opponent. So he is facing it head on. Dr. Hanna, thank you so much for coming on. We appreciate it.